everybody, I'm Susan Clinton, and I'm here with my co-hosts Carolyn Van Dicken and Gilletta Belton, and our very welcome expert for this project, Mary Wing, all the way from Down Under. And this is the third part of our project. This is what we call the C part of our project. We have A, B, and C. And this is the chance for all of these lovely people here on screen with us to actually chime in and ask their own specific questions to Mary about peer support. Thank you.
Awesome. So we have three people with us. We have Kat from Ohio. Did I remember that? Hi, Kat. Thanks. And Olga, all the way from Santiago, Chile. So welcome, Olga. And Denisha from Ontario. Where are you in Ontario again, Denisha? Mississauga. Okay, awesome. Great. So we've had an opportunity to listen to Mary and listen to, first of all, Gilletta talk to us from a patient advocate perspective on the importance of peer support in pain care and how that starts to build the social component of a biopsychosocial perspective, and the importance in low self-efficacy when a patient really doesn't have a lot of empowerment or feeling that they are in control of their pain, that certainly peer support can be one of those treatment strategies that can really help to build that. And so do any of you have any questions specifically for Mary at this point?
Not at the moment.
Not at the moment, Tanisha, that's okay.
No.
No, Olga, Kat, any specific question that has come up?
Not at the moment. Most of my questions have been answered by watching previous.
Oh, nice. Well, I have a specific question. Then why don't I start with, because we've had a chance to chat with Mary, and I'm a clinician first and foremost, and I mean, Susan is first and foremost a clinician as well, and Gilletta is very involved in patient advocacy. And I would say certainly as we represent North America, and Olga, you can chime in a minute about South America and see if that is any different. But I wonder, how do we really truly get peer support going, either in our cities or even just locally within our clinics and with our community? What does that look like? How can we do that?
Well, one of the best ways is, do you run pain management programs at all?
Some people do, like some clinics do. I would say in most private practices, there isn't a formal pain management program, except if you're in a publicly funded facility. That would be true, I would say, in Canada. What about the US, Susan?
I think most of the programs that exist in places like hospitals and medical center type places, or they're very much housed into the complementary medicine groups. So, the people that get together they have yoga, they have Reiki, they've got, different kinds of things that are going on, maybe meditation. And oftentimes you'll find some peer support groups housed in there, but not specifically aimed at persistent pain in the way that you've been talking to us about, Mary, for sure.
Yeah, and in the U.S., it's very interventionalist. Like our pain clinics and things like that are very much focused on interventions and not so much like a biopsychosocial perspective.
Yeah, it's like 1, 2, 3, 4, 5. Like they go to the group to learn how to do the following things.
Yeah,
in the States.
We have the same similar setup here. We do have most of our really good programs are attached to pain clinics in public hospitals, not all of them, but if you know somebody who's running these either in a hospital or somewhere else, I think possibly the best way to get this sort of rolling, and there's been papers written on this, I can send links to anyone who wants them, that in the last sort of 2 or 3 weeks of that program is to sort of initiate a conversation, and sort of you may be able to visit those programs and just sort of have a 5-minute chat and suggest that, you know, this is a good way to continue with what you've learnt and to have that social interaction still. And this is what a lot of people do, and this is what we do here with one of our groups. People go and they just sort of have a little chat a couple of weeks before the end, and the people who are running the pain management program can sort of have this conversation going for a few minutes each week as well. And at the end of that time, then people have this general idea that it's not a bad thing to do. Now, by then, there's also a good chance that you might have identified a couple of people who'd be willing to take it on as facilitators and get it up and running and perhaps run it, and then later on, of course, identify some more facilitators, etc. But it's just getting it off the ground that's the difficult part. There is some and somewhere to run it for a start, a venue.
Right.
Once you've got that part, well, possibly you need the venue first, because it preferably needs to be free, because unless someone's going to sort of support rent.
Right.
And of course, then there's the basics like printing, advertising, refreshments, and those kind of things. But if you've got a venue, then I would suggest approaching people who are running pain management programs. It doesn't mean that everybody who joined your group has to have been in a pain management program, but that is one of the problems with programs. When people finish, they are isolated often and alone, and it's very hard to sort of keep the motivation up, to keep that going, to keep your goal setting going, to keep your pacing going, particularly during a time when you're having some bad days and you think, oh, is it really worth it? It's not working, and it's very difficult. But if you've got other people that you know, it becomes a lot easier in that way.
Yeah, so I guess in private practice, is everyone here a private practice clinician? Olga, do you practice in a hospital or private practice?
Yes, in a private hospital. Yeah.
Okay. And Kat, how about you?
No, I'm someone who lives with persistent pain and is
okay.
in a peer support group.
Oh, very good. Okay, so you're starting up a peer support group?
I'm in the very beginning stages of thinking about it. One of the complications living in a very rural environment is there aren't any, not only peer support groups, there aren't any pain management programs. And as Joe had referenced, a lot of the medical establishment here is really, I can get pills, I can get nerve blocks, I can get, neuromodulation, but there isn't that biopsychosocial aspect happening anyway.
Right.
So, my questions, I guess, Mary, I appreciate your advice here as well, as I'm very much outside the establishment. And when I speak with my clinicians, this is not something that interests them specifically. But it seems like it would make so much more sense to have that partnership. So without the systems in place here, where would you recommend someone like me start in establishing some of those relationships?
It's harder in a rural area, of course. Do you know anyone else who has persistent pain at all?
Oh, certainly, yeah.
You do? All right, well, there's a starting point. I'll maybe start a coffee group or something, and or even a few of you get together. How many people do you know that would have persistent pain?
And that's where it gets complicated again in the rural area. Is I know many, but we're looking at 150 mile radius around
between. Okay, if you could organise to meet up and sort of talk about it, that would be the easiest way to go. Maybe one way you could do it is exactly like we're doing it now. If you have trouble with distance and things like that, it would be better. And then maybe occasionally, a couple of times a year, get together for a weekend, or just get together if you're not too far from each other, depending on where it all ends up. But then you need to, because if you get together, you can start to talk about structure and what you might like to do. And I think it's important to, have you done a pain management program at all, a biopsychosocial one?
Yes, I did, again, virtually. So I did from a university in Australia, actually.
Oh, I know the one. Yes. Yeah. Yes. Well, therefore, you've got all the principles that you need there. You've got the knowledge. So if you can find someone else, then you'd know then that with a support group, you need something for everyone. You'll need the social interaction. You'll need obviously to continue what you would have learnt in the program, or to teach people what they haven't learnt yet because they've not been. Things like goal setting, action planning, pacing, all those type of things that you've learnt, and there's dozens of them. How to have a good medical appointment, how to get the most out of a medical appointment, all those kind of things. What to do when you've got a flare, how to have some self-care days. I had one yesterday actually. So those kind of things are great to talk about, and it's also great just to have a talk, particularly in the times that we're living in now, where a lot of people have isolated, a lot of people have got more stress because of COVID-19, and it's a good idea just to sort of perhaps not get the whole meeting taken over with that, but just see if anyone's got any extra concerns, and you can sort of chat about those kind of things. You'd be surprised how quickly a couple of hours actually goes when you do that. And if you do know anyone who is what we would call down here user-friendly, who's happy to come on and be a guest speaker for you, that's also a good break. You don't even have to have a guest speaker that talks about pain. We're having an animal behavioural therapist in July. So, and we had a dentist who talked to us about the effect of medications on teeth last year, and this year he came back and he gave us a talk because he does all the work at the zoo. Some of those, some of those, yes. They didn't bother me, but I got a bit concerned about some people. I thought, oh my gosh, I hope they're all okay with this. But it was amazingly interesting just to sort of see something totally different. And it just gives everyone a bit of a boost, I think, to do something together that's not pain related. And then afterwards we did the pain. Then we even have a coffee break. We even get up and go away for 10 minutes and come back again. So yeah, I think maybe, you know, this kind of thing with Zoom is a doable thing for rural people. As a matter of fact, we've just reached out to our rural communities via our public hospitals and to see whether anyone would like to join our groups and come in.
Very good. So you're still meeting virtually at this point, Mary? I know you talked about that last month, but yes.
Yeah, right. We switched it all online about, I don't know. We've had about 5 or 6 meetings now, so we're having 2 a month. Okay. We've got three groups normally, but given no one has to travel now, we've just sort of said, okay, all in together, and we'll have 2 meetings a month. And yeah. And is that the frequency that you would recommend, sort of twice a month, to kind of develop that connection? And well, you can do that online. It's more difficult if you have to travel and people have to travel. We usually do 1 a month. Okay. Because also we've got 6 facilitators and we've got 3 groups to run, so that's about all we can manage. Yes. Once a month. Yeah. Right. Okay. Unless I don't want to lose all the facilitators and wind up on my own. Yeah. Right. I wouldn't last long either, I don't think. How did you identify facilitators, Mary? How did you, as people came to the group, how did you identify who would be a good facilitator? Gut feeling. People normally people who demonstrated that they were coping well. Managing their own pain fairly well, managing their setbacks fairly well, and just generally got it. Like the latest lady I asked to facilitate had been with us, very quiet lady, very quiet, considering her profession, which I won't say, but she's very, very well educated and very quiet, and she's been with us 3 years. And she was sitting by me filling out an evaluation form. And she said, I don't really know what to put here. And I said, well, why? And she said, well, because it asks what are the things that you found the most useful, and I find it all useful. Oh. And I thought, you'd make a good facilitator. Right. It's this sort of gut feeling that you sort of get to know people and you see how they're managing, how they're responding in the groups and that kind of thing. It becomes easier as time goes by, obviously, and you get to know more people. In the beginning, it wasn't so easy. We had a few people join who were looking to change jobs and needed voluntary work and things like that. But but you know, it got us off to a start, and they were amazingly helpful in the beginning for the first year, and I thought that was really good. Yeah.
Right. Okay.
But they were all quite young, which was really good as well. Now we've got a sort of a fairly big mix of age groups with our facilitators, so that's good as well.
That's lovely. Yeah.
How do people come into the group, Mary?
Sorry?
How do people come into the group?
They're often told about us if they're doing a pain management course. We also have flyers around all the pain clinics.
Mm.
And there's also some that are run by our primary health network. They have 2 pain management programs that are slightly different. They have a month of education, and then they can use up their psychology and physio appointments for some months after that. They have a certain allocation, and they will let people know that we exist as well. The uptake is not big. I think for every 20 people they tell, you might get one.
Mm-hmm.
I'm not sure why that is. I think people sometimes are hesitant. I think over the years, sometimes also, I think support groups for various conditions. There are support groups for almost every condition you can imagine, but we have been a bit lacking in pain, I think, but it's getting better. I think that some of them have had a bad name. I mean, you can't have a group where everyone sits around talking about their pain without any purpose or structure. But then you've got to be flexible so that if someone's got a major issue and everyone starts helping them with it, that's what peer support's about, you know.
Right.
So you have to be flexible enough to allow the time and sort of do away with some other activity we're going to do. We might have been going to do a guided imagery or something, and we'll just wipe that if we need the time for something else. We sort of go on the fly a bit and make notes to each other and have a chat at coffee break and change direction. I think I changed the subject there.
That's okay. That's great.
No, not at all.
That's what a discussion is about.
Kat, did you have another question?
Oh yeah, Mary, I was wondering, I know that you've been very thoughtful about training your facilitators. Now that you've switched online, are you finding that they still have the resources they need in this new format, or what different skills might someone need to facilitate via Zoom as opposed to in person?
Well, we've basically kept it fairly easy. We communicate with each other all the time via Messenger, and so it makes it easier than emailing, because you're not getting 6 and 7 emails every time someone wants to say something. As far as the rest of it goes, we basically do exactly the same thing as we do face-to-face. We have exactly the same format, right down to the coffee break, except that's not as long, that's all. We just don't leave it as long, probably 10 minutes as opposed to the normal 20, 25. And we literally do it exactly the same. We work out who's going to facilitate which activity, and we just go from there. And one person will more or less facilitate the whole meeting, and then each person comes and facilitates their little bit. And it isn't really different at all. Except for a couple of technical hitches we've had, but that's about all.
Yeah.
Can I ask a question here while you? Has anyone ever had this issue with trying to get into a meeting and getting a message that the host is in another meeting?
Mm-hmm.
So
does anyone know how to solve that?
So is the only reason I think that comes up is when the host is actually in another meeting, and until they end the meeting they're in, they can't start the next one.
It actually happens when you're just logged on waiting for everyone to join. I had a guest speaker, and I got a frantic phone call because we were all sitting there waiting and he couldn't get in. And then he said, look, I had this happen to me once. He said, everyone log off and then we'll all log back in again. So then I had him there and no one else could get in.
So, wow. That's that I have not heard of, but that doesn't surprise me for sure.
Eventually he set up a whole new meeting. I had to send him all the email addresses. I can't tell you what the stress was like. I sent him all the email addresses. He sent them out and ran it from his university account, and we all got back in again. We lost a few people along the way, but yeah, I was just wondering, I thought it might be handy for you too, Kat, if you did get to run your meetings online, if that happens, but no, there's no stop.
How far ago was that? Was that like 2 weeks ago, 3 weeks ago, 4 weeks ago?
4 weeks ago.
You know what was happening? That was when we were making the switch over to Zoom 5.0.
I thought it might have been.
Yeah.
Because I was already on
everything.
5 at the time. I was on 5 quite early. Yeah.
Yeah,
Maybe.
yeah. And so, but I mean, but during that, there was a time where they also went down, and because there was a weekend I was running a retreat and that happened, and whatever email system and link we were using, we just abandoned and started all over again with a brand new link and everything.
Right.
Yeah, so hopefully that won't happen again.
Yeah, I thought it might have been that because I reckon I'd updated to 5 about 3 days before that. So yeah, I think you might be safe,
Yeah.
Kat.
Olga, did you have a question?
Olga, yo, me?
Did you have a question? I thought I saw you trying to.
No, I do have a question, but I mean, here I don't know of any groups for peer support, except for oncological pain, like for people with cancer. But in our field, I mean, with Caroline in pelvic pain, I was wondering if you guys have suggestions, because at least here, people are kind of embarrassed about those issues. So I don't think they want to get in a group. So I was thinking that maybe it was possible to make like a pair, like to have 2 people like help each other or be there for each other, like people that have the same issues. If maybe that could be a good idea. What do you guys think?
You're talking like a buddy system, right? Like somebody gets with somebody else and they kind of help each other when they're having troubled days and things they want to talk about, things like that.
Yeah.
What do you think, Mary?
I think that'd be excellent. That'd be wonderful because look, peer support comes in so many different forms. I mean, think about it when mothers with new babies, just if they know just one other person who says, oh, I was awake all night last night, you know, that kind of thing. It can be anything. And I think having 2 people that are happy to have a coffee together and just sort of have a chat. I know that, you know, we had a street full of mothers and babies when I had young children, and if you'd had a really bad night and you didn't think you could really keep awake, you'd sort of wander and knock on someone's door and they'd take one look at you and say, come in, and the kids would play, you'd have a coffee, and everyone felt a whole lot better in an hour. Right. So I think that would be a wonderful idea, Olga, if you could sort of pair people up that you know you would just, there again, your gut feeling, go with, I always think that that's a good way to do things. Think about people that might get on together and sort of say, you know, would you like to meet? See how it goes. They might even invite other people, and they might even end up with a group. But it's really hard at the moment because people are just not out and not able to be out. So, I think probably telephone or online until they can go out would probably be a good way to go.
Okay, thank you.
Great idea.
I think that would be excellent. That's also been studied and it works quite well with war veterans and them getting buddied up with other people. There's been a study done on that, and that worked out more beneficial than not. They like to sort of, unless they get this massively huge benefit, they like to sort of be a bit funny about it. But I always think, well, what about the 47% that did benefit from it, you know? Look at it from that aspect with this particular kind of thing.
Okay, thanks a lot.
Hi, Nicole.
What I'm kind of hearing too, Mary, is like just have conversations and try something rather than wait until you think that you have something perfect to go out into the world with. Right. I think that we can all let the enemy or perfection be the enemy of just doing something, and there's going to be stumbles along the way, but through those stumbles you can learn how to make this better. And Kat, with the whole idea of rural areas, if it was something that was online, then it could be rural, you know, not even just in the US, but rural areas anywhere eventually, where people could come in like this. It's got me kind of thinking along those lines too, that people that just don't have access. I mean, and in the US, so many people don't have access to you know, good resources and support and education. that I think that there's a lot of possibility there. And in physical therapy clinics too. Like we've talked about pain management programs, but people who are seeking physical therapy for pain, that's a population to draw from as well. And those messages could then be reinforced through peer support, and
That's right.
a couple people could get it going. So what I'm hearing, Mary, is just do it.
Mm.
Well, that's, you know, what's the worst that can happen? Nothing much.
Right.
You can do it and tweak it along the way.
Mhm.
And we're even thinking of keeping our Zoom one going, if we can, along with the others. It's just a thought that's in the back of our mind, because there are people who would come some days and struggle. They may have had surgery. We've actually got people in groups that have had surgery, and if we were meeting face to face, they couldn't come. And then, of course, there's the rural people, and we might get a few more of those too. So we're seriously discussing whether we can manage that one extra one a month, because no one will have to go anywhere to do it, really. So yeah,
Well,
it is a lot of work. I mean, it is a lot of work, but yes, I would say get it started, tweak it because it'll be different everywhere. Everywhere will have different requirements. Every population's different. So I would say just get it going, and you would be amazed. You would be amazed actually at how grateful people are to just meet up with other people, because mostly you feel as though you're the only person in the world that's got that issue, and it's just not going anywhere. And it's one of the things that can actually dampen it down a bit, because there's a lot of good chemicals go on with social interaction with peers, I think.
Mm-hmm. You know, as we've been talking over the last couple months, I'm starting to think that maybe what I need to do in my practice is maybe put a sign up in the waiting room that says, we offer a peer support program. Would you like a buddy to walk you through this journey? And if people are interested,
Right.
then you try and pair them up, either by diagnosis or a little bit by interests or age or something where you might use some criteria. And then, but that means as well that we don't have to facilitate it. We're really just connecting people when we know that connection is so important.
That's right.
Yeah.
Yeah.
That's interesting. I've never thought about that before, so that's cool.
Yeah,
I like that idea. I also like the idea of what Kat was talking about, you know, because people are 150 miles apart in your area, which can be quite remote, but you're not the only area that has that geographical issue. And I could see how your group could grow pretty fast if people thought, I can get online from Stanley, Idaho, you know, and meet up with this group who are already doing this. And there's no one around me who's doing it, but I could like chime in, and maybe they get, you know, they're good enough to like start their own, you know, going out that way too. But I think that the virtual world has offered us some possibilities, I think, that we were afraid to step into. And I think now that we have to step into it, we have to be part of it, that we're starting to see some of these things like you were talking about, Carolyn. Like, how easy would it be for me as a clinician to offer my Zoom service to a group that wants to do it? And if having a pro Zoom account is is inhibiting their ability to do it, that's something I can do. It's like, here, you know, if you tell me what day and what time, I can make sure that no one's on Zoom at that time, and it's yours. You know, that's kind of what Mary was talking about, that you got to have as many free things as possible. So, you know, the room needs to be free. Well, I can, you know, one of the things I can do is I can offer my Zoom account for free once a month. What is that? That's nothing.
Yeah.
That's easy, but it has to be, you know, the back work has to be done, you know, to be able to, you know, kind of move this ahead. So.
Yeah.
That is the one drawback, isn't it? That Kat, that'd be the one drawback, the cost of the Zoom account, because the free account you can only have 40-minute meetings, and it's not really long enough. It's not prohibitively expensive. We had ours funded, so we were very lucky. But yes, there is the cost of the Zoom account.
Yeah, Mary, about how many hours a week does it take for you to manage and administer the, I guess, 3 groups that you have right now?
Well, it varies. Sometimes it seems to be more work than others. We've sort of got it sort of pretty much off pat now, so that we sort of can plan a meeting fairly quickly. Sometimes we seem to, if we run into problems or anything crops up, and I really can't even think of an example of that now, but if we've had a difficulty with a person or anything like that, we would have to have longer discussions and things like that, and it would go on a bit and take up more of the week. We spend a bit of time looking for good videos to show when we haven't got guest speakers. I don't know, and because there's 6 of us, we all sort of dob in a bit, and a lot of the stuff comes back to me, the communication type thing, because I upload all the reports. We have to write a report for our primary health network because they fund us, so we have a monthly report to go in. We have attendance sheets we fill out, so that mundane sort of stuff takes more time than anything really, and that doesn't really take a lot of time. I wouldn't say it takes like 1 week out of every 4 or anything like that. Probably a day, if you added it all up. If that's not counting the meeting times.
And this is perhaps a very American question of me, but do you carry insurance?
No, but then again, the places we meet, we're probably covered because we meet in a public hospital, and we meet in what we call a GP Plus, which is a public funded building with lots of different disciplines in it. And the third place we meet is a university. So we're probably covered by their public liability insurance, I would think. We've never even thought of that, to be honest. But then we haven't had to.
Yeah.
I'm sure we would, given that one of our facilitators is a lawyer. I'm sure that if we ended up not being in one of those places, that she would let us know we needed to think about that. So, yeah. But I don't know whether I don't know. I don't. You come from America, it's different over there, I think.
Yeah. Ain't that the truth?
Maybe ask a lawyer.
Kat, I have access to a healthcare lawyer. I think we can find that answer out for you pretty quickly. Just get in touch with us, and I'm happy to see what we can do. Just so that you feel like you've crossed all your T's and dotted all your I's as well. It is an American question. Thank you, Mary, because it's unfortunately what we have to consider in the States.
Online.
Yeah.
Not even a physical space, even for online, it would be something that I would want to check out too.
Right.
Really?
If nothing else, just to have a disclaimer or a consent. I consent to be part of this group, to do this, to do that. Just, it's probably nothing very big, but just something so that, everybody is kind of on the same page.
We do it for photographs. We used to have a written consent. We now more or less have, are you all willing to, if you don't want your photograph taken, don't be in it, and we just leave it at that.
Right.
We've only got one, and she's got a perfectly good reason for that, so she takes the photo. So that works out well. Yeah.
I think Denisha maybe had a question. Denisha, yeah.
Mary, I was just wondering if you always have a bit of a framework for your meetings. Like, is there a bit of a 4 questions or 4 activities you always want to cover, or how do you go about structuring?
Yeah, we would normally. We like to start with something like a video or a guest speaker for maybe half an hour to an hour, and then we have a break. We somewhere in there, we always do our action plans, which are our goals for the next month, and how we're going to go about doing those, and we like to have those written down. And we have the other thing that we always like to finish with, the things we call our small victories, which we've pinched from Pain BC. And that goes down very well, because we've had you start out calling it small victories, and people come in with these major things and you think, oh my gosh. And so that's been so successful. We do like to get that in. If we've got time to spare, we like to do a guided imagery, or one lady's good at doing meditation. So there's another thing. So we sort of plan what we'll do, and as I said, we keep it flexible in case something crops up.
Right.
But definitely we have a structure, but what we call a flexible structure. We don't sort of say, well, it's 10 minutes is up there now, so therefore we need to move on to the other thing. We just sort of, you can just tell when something's run its course or when something shouldn't be happening, and intervene that way. That's what we do have training. We've got 2 ladies who are very good at doing that type of thing, and we're very fortunate that we can get facilitators trained in that kind of work, in group work, but it's not totally necessary if you've got the knowledge yourself, and you've got, as I said, you've got the structure, but it's flexible.
Okay, perfect. Thank you.
And you're not going to sort of have, well, there again, you might have, you're probably not going to have 20 or 30 people at the first meeting anyway, and you might never have 20 or 30.
Right.
So, you know, I think they're just so glad to be there, quite honestly, that it works.
The connection, yeah. Thank you.
Mary, would you suggest, when I was talking about the buddy system, would you suggest that if you connect people that you put a little bit of structure in place, or do you allow sort of those 2 people to just kind of do what they need? So would you suggest that they do some action planning or goal setting with each other?
I would suggest that, it's good to put them together, but if there is a buddy system, I would suggest that it's a good idea to keep up with, well, if they haven't been taught how to do that, well, it might be a bit difficult.
Right.
But then again, there are things you can find that you could print out that suggest how to do that. There are online places they could go and look, but it's a good idea. I think that goal setting really underpins all pain management. I think that's the most important part.
Right.
Because it gives you that sense of achievement, and it shows you can actually have the pain and you can still actually get something done. Something that you want to do, something that's enjoyable, or something that you want to do that's a bit more mundane, but you'll still manage to achieve that. I think it's probably a good thing to reflect on the good things that have happened. As well.
All right.
As well as just chat about anything if you've got buddies together.
Great. Yeah. Excellent. So a bit of structure and then a bit of just let the people, right? Yeah. Okay.
Yeah, I love the whole, when you said, Mary, that sometimes you have things that are completely not pain related at all, because just that experience of learning something new and being curious and interested is so good for you, that everything doesn't have to be centered around pain. It can be centered around like living, and that's so important too.
Exactly. Because that's what it's about, isn't it? Learning to have that pain there in the background, but still managing to live and live the life you want to live, even if it's slightly different, and you have to modify it and you have to pace it and all the rest of it. It's still there.
Nicole, I know you joined a bit late, but do you have any questions of Mary on peer support? Is there anything that's kind of buzzing around for you?
Hi, sorry.
No.
Welcome.
Welcome.
Well, just offhand, just off the top of my head, as I was just listening to this, the buddy and the peer support, offhand, I just start to wonder about how do you mitigate a downward spiraling of the interaction. I guess you'd have to really know that that person or that individual is ready for such an interaction, that they're at that right stage. Because I guess I'm thinking more of those people that are just, all they can focus on is their pain, and then they just spiral and just always talk about their pain and this interaction with that person and the interaction with that healthcare professional, just those people that kind of are in that downward spiral. And that's certainly not the intention, I imagine, from the buddy system and the support. It's more to sort of get out of that rabbit hole. So I wonder, I guess that goes back to, like, is there some guidelines or an action plan to help?
Yeah, it's difficult. I do believe we've probably had, I can't say this for sure, but I suspect that some of the people who have come to the group and not come back again might be in that category. We have had some people in that category who have kept coming and managed to get out of the rabbit hole. But it is very difficult when people are at that point. If probably a bit of professional help to get a little bit past that point, or ask, it doesn't hurt to ask, would you like to join? And maybe they'll say, oh yes, that'd be really good, and it might work and it might not. Everyone's different, unfortunately, but yeah, I don't have a magic cure for that. That is very difficult. When they are in that position, it's really hard.
Is there any
I
research?
don't know whether, it would be even hard for a one-on-one buddy situation. I think it would be hard for the other person because they're not a professional. It would be hard for them as well. Yeah. I would suggest that a group would be better for people like that if you can find one. Even if we see now, we had back in the beginning, I think I mentioned this in the last talk, we had a married couple and he came along and he was just so over the moon about how good it was. He went home and talked about it for a month, and his wife was in a very, very bad way, and she came along and said nothing for 2 months. Now, 3 years down the track, she's amazing. She's the leader of the pack sort of thing. She's the leader of their pack, the two of them, and she is quite amazing. So yes, she was there and she did come out, but because she stuck with it, I think she just stuck with it. And on about week 3, she said 3 or 4 words, and month 3, and on the 4th month, she sort of came out of herself and said a little bit more and a little bit more. And you could see she wasn't as depressed. She was, and then they started to, she's never been one actually on goal setting. She's not really keen on that, but they've done some pretty big things between the two of them. So, yeah.
Sometimes those are the most rewarding. Some of those people that you see that they have such a flat affect, and you never know, are they hearing what I'm saying? How are they taking it? Do they agree? Do they not agree? You ask them, like, what do you think about that? And they're really not giving you a great response, or not giving and then you kind of think, yeah, they're not, this isn't working. And then for some reason, like you said, a month later, they come back and they blow you away with all of a sudden their affect has changed, their whole demeanor has changed. You're like, wow, I think they got it. Like the whole time you're questioning whether you're having any sort of impact on them at all. And it's interesting.
I think, I was thinking that maybe you can use like psychosocial measures, like maybe you're not gonna pair up two people that have very low self-efficacy together. That wouldn't be helpful. Or maybe two people that catastrophize a lot. That would be really bad, I think. If you pair two people, right? So maybe you can.
Sorry, go
ahead, Olga.
So maybe you can use those measures to try to think who to pair up. Maybe I don't know.
Think brilliant. I think that's a great idea. Or what about go ahead, Mary.
Not two people that are looking for the magic bullet either. Be careful of that. Because that's going to really go downhill.
Yeah. And what about using the pain stages of change for clinicians who hear, right? And are they pre-contemplative? Are they contemplative? Are they achieving change? You probably want people who are either contemplative or already achieving some change, and then they'll maybe really blossom and also lead potentially some of this peer support, right?
Yeah. I think it's definitely, it's great to be able to identify that stage, because if they're too far down, it's probably going to be very difficult. But hopefully those people will come up and be ready in time.
Yeah, for sure. And to know that at least the peer support is there, that they can come back and come to it when they're ready to do it. Yeah. Hello, Marnie. Marnie's joining us from Toronto. Marnie is a peer support advocate as well, who is starting a pelvic support group in Canada. Marnie, do you have any questions for Mary? We're going to wrap up in the next 5 or 10 minutes, but I wonder if you have anything specifically that you want to ask.
I just joined, so I don't know. That's I haven't really got a grasp on what you guys have been discussing. So if you want to just recap,
Sure. So we have been just chatting about peer support and how to actually put peer support into practice, really the practicality. And so Kat is a patient herself, and Kat from Ohio is trying to decide. Marnie, can you just mute yourself for just a sec? Yeah, I'll just mute you. There you go. And then unmute when, so Kat is trying to think about how she develops a pain support program. And the rest of us, I think, are all clinicians. And so we were looking at it more from a clinical perspective and how to develop sort of peer support within our clinics. So I know you're just in the midst of starting this support group for pelvic health.
Mm-hmm.
So if you have any practical questions yet for Mary around how, how to organize that best or how to organize meetings, Mary talked about having a structure for meetings where you start with a video, or you start with a speaker, and then you very much, have everyone go through their action plan or goal setting. And then you're going to have a coffee break. Coffee break is really, really important. That social connection is really important as well. And then we're going to look at celebrating small victories. So everyone's going to go around and say what they've been able to achieve over the last month or since the last meeting. And then the last piece may be to finish off with a meditation or some sort of group activity. So I think having that really nice structure is a great way of looking at developing peer support.
And if we don't have a speaker or a video, we will sort of think of a topic maybe to do with pain that we haven't talked about for a while. That sort of, and we've got new people, and it could be anything to do with pain management. We might just bring that sort of up. And at the moment, as I said, we might probably, I think at the next meeting, we're planning on sort of revisiting the COVID-19 situation and finding out whether people are having any extra difficulties, because we haven't done that for the last couple of meetings. So we'll see how we go with that. We do have a speaker, but we'll still fit that in.
Nice.
So what exactly is the structure? Like, how is this? Is this just something that's going to be done through Zoom, or is this new, or is this something you guys have been doing?
So Mary's been doing this for several years. So I'll let Mary talk to it. Yeah.
We have face-to-face meetings that we have in various areas of the city we live in, and we've been doing that for 3.5 years now. And we have 3 a month, like one in each area. But since we've been sort of in lockdown, although we're slowly coming out, but since we've been in lockdown, we moved on to Zoom. So we combined all the groups together basically, and said we'll have 2 meetings a month. You can come to one or both, whatever you feel you want to do. And that's been working quite well. And as I was saying before, we have maybe a video or a speaker or a topic that we'll discuss. We usually go for about an hour before we have a break. And normally when we're face-to-face, and even when we're not, I've heard people, when I've gone out to make a coffee, I can hear people having a conversation, just like a chat about anything, which is really necessary, I think, that sort of social interaction. And then depending on how much time we've had left, we do like to do our small victories, and we also might do a guided imagery meditation or another meditation that one of the ladies in our group is particularly good at. Or obviously, if anyone's got any issues they need to talk through or want help with, then we fit that in too. So we get it all in. Sometimes we leave. Usually, what we leave out if we do run out of time is the meditation.
Right.
Because yeah.
So it's about an hour in total?
2 hours. 2 hours.
2 hours. Okay.
That allows us time to have that good social interaction in it as well. No one's obliged to stay the whole time. We do ask people if they can come on time, because if we do have a speaker, it's nice if everyone's actually there. So, But if anyone needs to leave early or can't stay that long, and of course when we're in face-to-face, or even when we're not in face-to-face, people can get up and move around. No one's obliged to sit down for 2 hours or anything like that. So, and look, we have a lot of fun, trust me. I used to go, one place we used to meet, the Health Consumers Alliance of South Australia, we lent us their boardroom for a couple of years, and I used to worry that we were too noisy for them, and they used to say, don't you worry, we are so happy to see people in pain having so much fun. Yeah, we sort of do have a lot of fun, believe it or not.
Is it geared towards a specific group of pelvic health patients, or is it open to anybody?
It's open to anybody, open to anyone. A lot of them are referred or come after they've done a pain management course.
Right.
But some of them just pick up one of our flyers in a waiting room, or if we can afford to advertise, we've done a bit of advertising in a local paper, which is now not going to come out anymore, so that won't be happening. We've come to us like that, but mainly we've just had a lot of new pamphlets printed, which we haven't been able to put out anywhere yet. We can't go anywhere.
Direct mail.
So we're gonna wrap things up at this point, because we've been at it for about 45 minutes, and so we're gonna wrap things up and thank Mary so much for all of her wisdom and insight into this really important aspect of pain care. Thank you everyone for joining us and for contributing to the questions and the discussion. We wish all of you the best of luck as you start to contemplate the role of pain care, either if you are a patient or a patient advocate or a clinician, and thinking about what is the role of peer support in my pain population. So thank you again, Mary. We really appreciate your time.
Thank you for having me.
And
Thank you, Mary.